If you run a pharmacy, you already know this. The phone never stops ringing. I need to refill a prescription. Is my refill ready yet? How much is it going to cost? What time do you close today? Where are you located? Same questions all day, every day. Here's the problem. About 35% of healthcare calls go unanswered. That's 1 in 3 calls. And each missed call could be hundreds to thousands of dollars in lost revenue. But the real cost isn't just the calls you miss. It's the conversations that never happen at all. Patients who forget to refill. Patients who skip appointments or drift away because nobody followed up. So when pharmacy owners hear automation, most think about cutting costs, not growing revenue. It's often seen as a defensive move. Handle more calls with fewer people, reduce interruptions, and avoid burnout. And while that's true, it's also incomplete. Because what's emerging across healthcare right now is something different. Systems that don't just respond, but initiate. AI phone systems that reach out to patients proactively, to refill medications, to schedule vaccines, to remind about pickups, or to react to those who've fallen off. And while that might sound futuristic, it's already being implemented in urgent care centers, dental, and even pharmacy, including some of our customers here at VOXO. In this video, I'll show you how outbound AI, when applied thoughtfully, can help independent pharmacies recover revenue for missed refills, increase follow-up without extra staff, engage patients after hours, and free up your team for higher value patient care. I'll walk you through how it works, what's already been done, and where this technology is headed for pharmacy. Now, what's most surprising isn't how AI answers calls, it's what happens when they're the ones making them. We'll get there in just a minute. So we often think of refills as routine, but routine doesn't mean automatic. The reality is many refills go unfilled each month, not because the patient isn't interested, but because nobody reminded them. They forgot, or they called after hours, or they planned to call and just didn't. This is where outbound AI steps in. A pharmacy agent can be configured to automatically reach out when a medication is due. If you don't know what that is, imagine ChatGPT with a voice and a phone number, fully integrated with your pharmacy management system, so it can take action, not just talk. It might say, "Hey, we see you're due for a refill on your blood pressure medication. Would you like to refill it now?" If the patient confirms, the system can verify their date of birth, submit the refill, and confirm when it will be ready, all without requiring staff time. In one published study, refill reminders increased refill rates from 18 to 31%. That's a 70% improvement. And this isn't a future case scenario, that's a real outcome from proactive, consistent outreach. And what's even more important here, that refill didn't just create revenue, it prevented a patient from falling behind on their care plan. This isn't about sales pressure. It's about ensuring patients stay on therapy while keeping your pharmacy financially stable in the process. But missed refills are only the beginning. What if your system could reach out before the patient even realizes they're due? You see, historically, pharmacy communication has always been reactive. The patient calls, and we try to keep up. But what's proven effective in other sectors is flipping that model. With outbound agents, pharmacies can now do many of the things you see on the screen. And this isn't about selling services, it's about showing up consistently so patients can stay on track without needing to remember everything themselves. For example, here's something we've seen time and time again. Patients think about their prescriptions when it's convenient for them. That might be 10 p.m. after putting their kids to bed, or on a Sunday evening before the work week starts. But most pharmacies are closed during those times. One of our customers, Panama Pharmacy, reported capturing 76% more automated refills with a pharmacy agent than from the old tech like IVR alone, which is the classic touch-tone automation. Traditional phone systems just capture messages after hours. Agents actually complete the work. Instead of a voicemail that waits for staff the next morning, the agent actually holds a natural conversation. It verifies the patient details and submits the refill to the PMS. It confirms pickup or delivery and eliminates the manual data entry or the misheard voicemails. And when patients can reach you after hours, they stop turning to the competitors who never close. So this isn't about being always open. It's about making sure patients can reach you when they're ready and that their request is fulfilled before someone else gets their business. So what happens with all that time that we just saved? Well, this next example, I'm going to show you what that means financially for you. One of our pharmacy customers used VOXO's inbound automation to reduce live call volume by 60%. That resulted in about $8,000 a month in time savings. Not because they hired fewer people, but because the people they had were able to focus on higher value work. Now, what did they do with all that time? They could expand vaccine availability. They could increase their medication therapy management consultations. They could follow up on prior auths. And they could help patients better understand their medications. Combined, those services are on track to generate an additional $15,000 a month. Not hypothetically, but through repurposed staff capacity. This wasn't a marketing campaign, it was simply staff doing what they've always wanted more time for, and finally getting the time to do it. Because when the phone stops ringing as often, staff don't disappear. They re-engage with patients more deeply, and that shift drives meaningful clinical and financial outcomes. At VOXO, we're not just building a general phone agent. We're studying what's already working in other areas of healthcare where these tools have been alive for the past year and making it better for the pharmacy world. For example, at one hospital, 91% of COVID vaccine calls were handled without a person. We're talking that's 3,500 calls per hour at peak demand. And in dentistry, 50% reduction in missed calls after implementing an AI receptionist. These organizations aren't exploring agents because it's trendy. They're using it because patients respond, staff breathe easier, and systems scale better. And now, pharmacy is at this turning point, and VOXO is actively working with early customers to implement this for our world with pharmacy-specific language, refill logic, and integration path. And while every specialty has different needs, the patient expectation remains the same. They want immediate, accurate, and human-like support whenever they reach out. So, we looked at a side of AI that's easy to miss. Not the part that reduces calls, but the part that restores connections, that brings patients back, that keeps medications on track, and that gives your team the space to do what only they can do. All right, that's a wrap. If this was helpful to you, please subscribe to our channel. I'm Brennen from VOXO. I'm gonna keep sharing some ideas with you. If you like this, keep coming back.